So before I have few issues over here, first of all, just wish to acknowledge for just to hear the attention, the privilege that our communities are facing. So I have a few, before I share some important issues here, so I just needed to quote it from what you just said to the meeting today. It's quoted, these consultations are the hearts of our participation governance. So by saying that, so I have, you mentioned a little bit about health program, and we do understand 150.5 million that the government invests on the health program. But the challenging issues now, we also wish to acknowledge the number of graduates for the past years. But the challenging issue is that the job opportunity or the job market for our graduates, the new graduates. By saying that three academic universities in the country right now, by saying University of Fiji, Fiji National Universities, as well with the USP. So different programs, what we've seen now that three universities are like competitions on different programs. But the challenging is our graduate in the job market opportunity. We do understand that some of who goes to the NET program, some are graduate who look for job opportunity, which our country needs to relook at that from our priorities. So give you an example with the program offered by Fiji National University and the CAST. But unfortunately, this is the only program that offered by Fiji National University in the past years. But the requirements with the job opportunity with FRCS, I do understand in the past years, they only required a degree program. But with the institution, with the academic, they only up to diploma. I do understand this is a new, the structure, the revisions is going through with the Fiji National University right now. But I'm hoping that if government really look at what other three academic universities the institution been offered, given to the science program, talking about public health, talking about nutrition, dietitians, physiotherapists. We have number of graduates, but we have challenges with the job opportunity. There is no clear demarcations or discussions between academic together with the industry who provide a job opportunity to our graduates. The second issue also needed to highlight it. I also represent the organizations who they advocate for people living with diabetes. For the past years, we made submissions to your office, but we've not never seen any indications to somewhere to be indicated as support, talking about diabetes or generally NCDs. Some of the issues we raised in terms of introductions of tax on sugar and sweetened beverage that we think of how we can relate to other developing countries. We do understand that the government make the investment, make more revenue from taxations on the sweetened sugar and beverage product can be include tobacco and alcohol as well. It's something that can invest back to our dedicated organizations such as us or other NGOs or CSOs who are there who can do support the Ministry of Health initiative. By saying that, there's other options we can consider in terms of make an investment or subsidize the cost. We do understand that most of our NCD, I'm talking about speaking on behalf of our vulnerable communities, who are having financial issues buying the glucometers or the consumables that for them to make accessible to them. By if you have something that we can consider to help them by making subsidize the cost, make accessible to our general community. And also, we have a challenge with the Ministry of Health Research Program. It's something that we're thinking of. This money can be directed to help the availability resources that we have in Fiji. But we currently advocate more on modern medication. But we have something that our forefathers usually promote. It's something that we can consider in terms of research as well.
Thank you. Thank you very much. And two very important critical issues and put very eloquently by you. The first one, you are absolutely correct when you talked about what the universities are offering. And as I said earlier, what happened since 2012 and 13 when they brought this TEL scheme, they said everybody is going to get loan. So you went to the university, you went to FNU, you went to USP, you went to University of Fiji. The floodgate was open. The universities started offering whatever courses they felt was important. And so many students, as I said, about $160 million worth of loan went to students who did not even complete the degree. And those that should have gone into a particular program, those who should have become a good plumber or an engineer or a mechanic or a joiner, tried to do a degree. And when they were not successful, they wasted that money. Plus, if they managed to get a degree, they had to compete with other students in that area. So you're absolutely on the dot. And you gave examples of the program that some of these universities run. So what we did when we stopped that TELS loan scheme, we brought merit-based scholarship and we said, if you want to become a doctor, these are the number of scholarships for doctors, these are the number of scholarships for nurses, dentists, different categories. And if you didn't make it to this one, you can go into this one or you can go into. So basically what we are now doing is based on our manpower needs of the country, because we've made that assessment. We need a lot of technical people. There is hundreds of jobs everywhere in different sectors where we need workers. We need plumbers, we need mechanics, we need electricians, we need joiners, we need good plumbers. And we have to now import that labor from overseas because we were not training the technical colleges that were set up by the previous government. We lost about $30 million, all of them closed. So what we've done since we've come into government in the last 2 years, not only we've rebranded and demarcated the programs that needs to be supported through scholarship, we are supporting technical education. We have given scholarships. So if you go to uh, Pacific Polytech, or you go to FNU, or you go to Montfort Boys Town, or you go to Nandave, or you go to a hospitality school or a caregiver training center, you get scholarships. And students are now going there. And they are being trained to get the jobs that are there. We are getting painters, tile layers from overseas. But there are many students many people who have left, young people who have left school, we are bringing them back. We are bringing them back, we are putting them in the training schools so that they can get the job. So sometimes it's the type of training and skills that we develop, and we've started that very well. It's producing results now, but it'll take about 3 or 4 years once this group that was already there under loans has now gone into scholarship. Once that group is gone, the new scholarships that we've started offering from last year, and the first lot out of those scholarships are graduating this year. If they are doing certificate or diploma, if they're doing degree, they will graduate at the end of next year or at the end of this year. And that's when these people are going to find it easy to fit into the labor market. And unfortunately, as you said, there were qualifications. For example, FNU used to run a program and said, you do this and then you get funding. Never happened. You talked about customs. Why do you offer a certificate when you know that the employing agencies require at least a degree. So we are rationalizing that, and hopefully from this year and from next year, students coming out with appropriate qualifications would fit in appropriate jobs. So when you look at, when people say there is unemployment, yes, some people are unemployed because they can't be employed because they don't have the skills. But there are jobs available that we don't have people for. And some of them we have to bring on. And so that's why we have put in money in a big way, scholarships, technical education, re-establish some of those. In fact, it was working very well. The technical education in this country from the 70s, 80s, 90s, until it was broken by the Bainimarama Ayaz government completely. You had schools like Risikul offering, technical education. Students had a pathway. They closed all that. They set up technical colleges, put in $30 million, went down the drain, poorly managed, closed. We came and we are now doing that. And I think it will take another 2 or 3 years that we would be able to do that. So it's you put it very well, and you summarized it very well, exactly what has happened, in terms of the labor market. The second point that you make is again very valid. We got the World Bank to do a report on the public health, NCDs and all that. And that report was launched by the Honorable Prime Minister. And what it shows that in the 1970s, 80s and 90s, our health outcomes were better than what has happened in the last 10, 15 years, 20 years. NCDs, incidence of NCDs is very high. Productivity, people who reach 50, their productivity is half. And so we are now involving a lot of NGOs. In the last budget, we provided funding to a lot of NGOs because we feel that you can do a better job in terms of advocacy, in terms of education. And we will talk to you after this, find out what organization was. But we've given a lot of funding. And let me say this. There is no shortage of funding for our health ministry. There are issues about things getting done on time. There are issues about processes that were put in place. There are issues about infrastructure that was not there. And so in the last 2 years, we have been providing adequate budget, and some of the bottlenecks that were there, we are clearing that now, and I am confident that once all this work that is now being done is completed, shortage of medicine, shortage of consumables is going to be a thing of the past. There are challenges with respect to personnel, in technical areas, nurses. We provided additional funding in the last 2 budgets to Sangam Nursing School to produce additional nurses. We created new positions for nursing aides and nursing assistants, which was never there, because we wanted these category of people to also go and help the nurses do the clinical work instead of doing things that can be done by nursing aides and nursing. So a lot of these things have been built in the last 2 budgets. But thank you very much for raising those 2 very, very critical, important issues, and I appreciate that very much. And we'll talk to you about your organization after this.